It's the mall that has it all. We have great food, a relaxing atmosphere, and activities for all ages. Tennis, swimming, and a playground. But the fun doesn't stop after dark. There's even a bar and an arcade. And if you aren't ready to go home yet, we've even got a spacious room for your comfort, complete with air conditioning, Wi-Fi, and a private bathroom. The Toucan Mall can also facilitate your event in our spacious conference hall. We also have a theater with films for the entire family. It's the Toucan Mall located in Amelia's Ward, Linden.
Here we go. A very good evening to all of my friends and relatives, well-wishers, and all of you who are out there looking at us. Welcome once again to our program. And I'm happy to be able to come to you. At least I'm getting to you, because under normal circumstances, without the technology, it would have been so difficult. I would have had to find ways, maybe find a craft of some sort to get where I need to go to be able to be live with you. So welcome to our program this afternoon again. And this is already the 13th day of August. Already. And the months are just quickly going by. I don't understand. It's racing to the end of the year, and it's just unfortunate now that we are going through a crisis with the coronavirus. And well, we had two crises. I guess I'll keep two viruses. One was the election virus. One was the electoral virus, which is over now, and the second one is the coronavirus, which is still on. And unfortunately, the numbers are climbing. We don't really want that. They're climbing. And I'm concerned about that because many persons don't have any symptoms and they're walking around without mask, transmitting viruses, and nobody knows. So you need to keep your immune system up. Bottom line, whatever it takes to get your immune system up, get it up. If you gotta live on jamun, get it up. If you gotta live on oranges or lemongrass or peppermint, I don't care what you gotta live on, get your immune system up to make sure that you safeguard yourself from those careless people who are out there transmitting different types of viruses, including the coronavirus. All right? You want to also follow the procedures. Avoid gatherings. Never mind, if you are going to be in a gathering, protect yourself and protect others. Wear proper mask. I've been saying that over and over. Many persons are making face coverings, but they're not making mask. Protective mask. Not everything that you cover your nose and mouth with is protecting you from droplets. Because if you sneeze and it's the wrong thing, it'll come right through there. Okay? So you make sure that you're wearing a mask and not just a protective covering. All right? So many persons are not feeling well. So many persons are sick. And many of those are sick and tired of being sick. And as a result of that, the hospitals are becoming filled with people, the clinics, everywhere. We don't know what's going on. Okay? So if you don't have to go out, stay home. Seriously. Because in that environment, at least you're safe. You know, no one in there would have something, hopefully, to transmit to you, you know. So you stay home if you have to stay home. Unless you have to go out, you stay home. And if you have to go out, stay at least 6 to 10 feet apart. Sometimes 6 is not enough, because if the wrong person sneezes, 6 feet is a joke. Okay? Think of a sneeze as if it's a gas or a fart, as we say fart. Think of a sneeze as a fart. You know, there's some people who, when they pass wind or pass gas, 6 feet is nothing to protect them from the odor, right? So you think of this virus as if you're thinking about somebody passing a gas that illuminates the place, or not illuminate, or takes over. You know, it just lights up everything, right? Think of the virus as one of those, and protect yourself. Wear a mask so you can't smell when somebody pass gas. If you can smell them when they pass gas, that means your mask is no good. Straight up. If somebody pass gas and you can smell the gas they pass, the mask is porous. It ain't protecting you from corona, right? So you make sure you wear a mask, and if you could find an expert, get the expert to pass the gas, and see if you could stand the smell. If you could smell it, then you need to get a better mask. Okay? Many of those face coverings that you're wearing, if the person passed the gas by you, you're going to be blown away. Right? So get a mask and not a face covering. Okay? All right. Today I want to share some beautiful things with you. Okay? We're going to start it in a few minutes. I see my operator jumping around. We're going to start it in a few minutes. But there's some information that it might surprise some of you, but some of you already know, and some of you practice some of what I'm going to share, but not all of you. And some of you may have missed some of what I'm going to share, and you may get the rest of it today. Okay? These are simple remedies and processes which can benefit you in many ways. Some of it talks about foods that you can eat before you go to bed. Some of it talks about food that you should not use unless you plan to go to bed in a few hours. When you see these and you learn of what they are, you may realize some things that you're doing wrong in your life, in your diet. You may realize why you're having gastric problems. You may realize why you're having brain problems, you know? So call your buddies and let them know that in a few minutes, we're going to be talking about simple things that you can do to avoid a lot of calamities. Seriously, all right? I know my operator is trying to get the report for me. I told her we don't really need it, you know, so don't bother with it today. I think that that many persons are going to have that report anyhow. So that's in the news, it's in the newspaper, it's in places that you could find, you know, it's not secret, right? So today I wouldn't bother with that. I want to give you information that can benefit you, that can take away some of the boredom or the stress that you experienced over the months or weeks or even today. You know, some persons are. I had a patient yesterday, 2 days ago, not yesterday, 2 days ago, who was so messed up. She was a nervous wreck. She was just in all sorts of distress. And I looked at her and I'm saying to myself, what's going on here? You know, what's really happening to you in my mind? I didn't know what was wrong with her because I'd never seen her. So when she sat down, we started talking. I realized that she had some issues. And I want to speak with you today about some of those issues that you don't need to have. Okay? Many of you are fatigued and stressed and in serious mental distress. Many of you. Many of you are going through divorces because you learn now that your spouse is not who you think your spouse was, right? Because you've been home all this time with your spouse, right? Many of you are in relationships that are going to be past relationships because you realize over time, because you had time, that the person that you're with is not the person that you want. Many of you are going to lose your jobs because the businesses that you were working for are now closed. Many of you are not going to be able to open your business again because people are doing what you did to earn your pennies or your dollars. They're doing it differently, so they wouldn't need your service anymore. So many of you business people will have to rethink your strategies as to how you plan in the future to do your business and what type of businesses you're going to do. It's not going to be business as usual, I can tell you that. I was walking yesterday and I'm looking around at people and I'm seeing people with masks of all kinds of face coverings, and some with special things on them and some with animals on them and birds, and you know, I'm seeing all sorts of different face coverings, and I'm saying to myself, wow, things have really changed. Now you can't even recognize people's faces. It's a serious thing, you know. You can have a criminal walking next to you and you don't even know it. It's a serious thing. You can have a criminal walking behind you, walking in front of you, in the vehicle with you, in your taxi, in your minibus. And because of the covering on the face, you can't recognize them. This is a serious time. You know, we are letting people come into our businesses and they have covering on their face and we can't recognize them because they don't take the covering off their faces. So my friends, we're going to have to change how we do what we do. Seriously. Because the criminal looks at these opportunities and will capitalize on them. Lots of criminals out there. You have people who are just planning how to rob others. People who are planning just to swindle, how to swindle others. People who are planning how to steal people's cars and bicycles and motorcycles. You have people who are planning to break into people's homes. I'm telling you, the criminal minds are busy, and we have to begin to think about changing the way we do things. I'm serious. You know, when someone approaches your business, it is important, because we're small, maybe to have them pull their mask down so you can recognize who they are before you let them into your place of business or your home. This is serious. Because when the mask is on a person's face, you really can't make them out thoroughly. You will be able to look, maybe some people you recognize that you deal with every day. But when strange people come up to you and they have a mask on, you don't know really who they are. You know? So we need to start thinking about maybe restructuring how we do what we do with the mask, because the mask is going to become a part of society. I'm telling you. You will have people walking into congregations that are not church-going people, and they're coming there to maybe see how you operate, to see what you do and all that. You've got to begin to think like the mind of a criminal, because they're planning too. This is the environment that they like. I'm saying this to you, my friends. It's not going to be business as usual, and it shouldn't be done that way with yourself. Start thinking about things differently and start planning that when people approach you, how to recognize them. Seriously. Because they can hide under the mask. They can hide under the mask. You know, and I have to tell you that you see me looking down, I'm looking down because this is how I communicate with my operator. You know, where she's in one side of the world and I'm in another. And we have to communicate on the phone. So I gotta check to see if she's, you know, sending me a message or she's telling me hello. She does that sometimes. She heals me up, you know. She tells me today, you know, that the planes are flying and I should come back home, but like I don't want to come back home. It's not that I don't want to come back home. The planes ain't flying from where I am. Not yet. I want to come back where I belong, believe it or not. But we are not even flying. The airline that I travel with is not flying into where I need to go. And it's not open either. It's not open to regular flights. It's open to special flights, unless I want to go as cargo. You know, cargo is going, no problem. But maybe I'm somebody's cargo, but I'm not regular cargo. You know, so, my friends, it's a scary thing to think about the times we're in. And some people say, oh, it's the end time, and it's you know, we don't know when the end time is going to be. I want to be realistic. Some people say to me that, oh, Jesus is coming soon. Yeah, we know he's coming soon. But he's been coming soon since I was 2 years old. You know? No one knows it when he will come. Nobody knows. It is told that he will come like a thief in the night. Do you know when you expect a thief to come? Do you know when he's going to come? You don't. Right? So you have to prepare and plan and make sure that you're ready. Okay? Now, we talk about your immune system. We talk about face recognition or recognizing people when they come in contact with you to know who they are. And now we want to talk about food, right? We want to talk about food. But before we talk about food, I want to tell you about fasting, okay? Some of you need to go on a fast. Seriously. Some persons need to really cleanse and remove all the garbage that you've had over the months that you didn't do nothing but eat. Some of you need to really remove lots of the baggage that you would have loaded yourself up with, that you have to break down and get rid of. Most of you have gained weight. Most of you. I hardly find anyone when I screen them who didn't gain weight. Everybody almost put on weight. Because you're home, you're eating, you're drinking, you're sleeping, nobody walking. Nobody walking, you're not exercising. So guess what's going to happen? You're going to get sick. I don't care what you tell me. If you don't cleanse, you're going to get sick. Because a lot of the garbage that you had is being reabsorbed over and over in your system. And that toxicity is going to hurt you. Then you're going to come running to the clinic to us in Kitty to see what you need to do to be able to get better tomorrow. I don't know, buddy. I don't know, sister. But miracles happen. But I can't promise you a miracle. And for the time that many of you are sick, you need a miracle. And for the state that you're in, many of you need a miracle to get better. Yes. Some of you wish there was a way you could just blink your eyes and lose the weight. I know. It doesn't happen like that. You're going to have to get out there and work. Exercise. Close your mouth. Change what you're eating and drinking. Change how you're eating and drinking. Stop eating all the junk and drinking all the junk. Yes, you're going to have to do that. The weight is not going to just fall off of you. And let me tell you something. It comes on you like lightning, and it goes away like a turtle. It doesn't go away that easily. It does not. So I'm saying to you, start thinking about the next step. What am I going to do? So you're going to fast. What is the fast? The fast could be one with fruits. It could be with vegetables. It could be with water. It could be with juices, like, pure juices like that. That's grape juice. Pure grape juice in its purest form, organic. It could be pineapple juice. It could be a fast that you don't use anything but water. Why you fast? You fast because you want to finally give your organs a chance to rest. Yes. That's the first reason. Because many of you have not given your organs a chance to rest since you were born, since before you're born. Yeah, man. You've been drinking and eating since before you're born, and some of you ain't stopped yet. So the organs are working and working and working, and you're wondering why you're aging, why you're feeling good, why this, why that. Organs working non-stop 24/7. All of them. They work together. And some of them ain't even working good. But before you begin to get into your exercise routine, if you have a physician, you check with the physician. But I would say you start with a walk. You fast and you walk. And you walk at a pace that you can manage. And gradually, as you continue to walk from day to day, you change the pace that you walk, increase it. By increasing the pace that you walk, you're actually increasing the metabolic rate once your thyroid is working good, and you will continue to begin the process of burning the fats. Why? Because if you don't put the fat in, the body will turn in itself and use the fats that you have stored. That's how you lose the fat. Unless you suction it out or freeze it, like they say, they do all sorts of things. But you want to be able to starve the body of the fats that you put into yourself every day and allow it to turn in itself and use what it has stored in your body. Yes, you need some fat, but not all the fat you got. So you close your mouth. Stop eating and drinking the foods, and so you eat junk foods and all that. Use some water, use some juice, use some fruits, and don't use no cooked food for 1 week. Try it. For 1 week, tell yourself, I am not going to cook anything. I'm going to eat raw fruits, vegetables, maybe some nuts. And you're going to be surprised to see, number one, that you're not hungry. Why are you not hungry? You're not hungry because you're satisfying the body's needs. You're feeding it what it needs finally. And you're giving it a chance to use up what it stored up. I was telling someone this week that I saw. I asked the question, tell me something. How often do you clean your house? They didn't know where I was going. So, every day. I clean my house every day. Sure. Yeah, most of the time I clean every day. I asked, at least do you clean it once a week? Oh yes, of course, once a week. I've got to clean my house once a week. I change my towels, I change my sheets, I sweep the floor, mop it up, clean the chairs. By the way, when you're cleaning, clean the doorknobs too. The doorknobs, the pipes, the faucets, the handle of the toilet, because you pick up a lot of bacteria there, right? So I said, all right, well, if you clean your house at least once a week, why aren't you cleaning the house that you walk with at least once a week? God's house, the temple, why not? I said, for true, for truth. I never think like that. You don't want to live in a dirty house, so you clean it once a week. Well, most people, some people don't care, right? So why you want to carry around a body with matter that needs to be excreted in it? At least once a week, do some cleansing, kill some worms, worm out. Some people tell persons that they need to worm out maybe once a year. You crazy? You're eating chicken, fish, beef, pork, and everything else. Guess what? They come with larvae, they come with worms. You wait once a year to clean them worms out, you're going to have a whole army of worms. Deworm yourself once a week on a weekend. Yes, I say so. Deworm on a weekend. You clean your house, you're in your temple, your body. Clean it house, detoxify and deworm once a weekend. You want to get well and stay well? Do that. You will see the difference that your body will feel, what it will make when you do that. You won't believe it. Trust me, you wouldn't regret it. Right? So you fast and then you do these things. First of all, you can drink some coconut water. Yes, coconut water is plenty in Guyana. I know that for a fact, right? The benefits of coconut water. First of all, it will boost your circulation. It will boost it. It will keep the body cool. Never mind how much coconut in the sun. If you cut it off the tree and cut it open and drink it, the water cool, right? It will rehydrate you. Rehydrate, put back the natural minerals that you need in your body. It carries nutrients and oxygens to your cells. Coconut water. It raises your metabolism and help you to burn. It will promote weight loss. Yes, it makes you pee all the time. It does that, right? It boosts your immune system. Coconut water we're talking about. It boosts your immune system. I hope my operator have it on the screen there, right? It controls diabetes. Thank you, she does. It controls diabetes. Coconut water, yes, controls diabetes. I said cure, I said control. Detoxifies and fights viruses. Who wouldn't want to do that at this time? Coconut water. Cleans your digestive tract. Coconut water does that. Balance your pH level. Coconut water. Treats your kidneys and urethral stones. Coconut water can even help you to move those small stones you accumulate in your kidney and urinary system. Coconut water. Yes, coconut water is loaded with nutrients. Don't underestimate it. It's very good for your body. Very good for your body. Secondly, I want to talk about something that I don't think you may have noticed it, many of you. I'm breaking the order here, the operator. I'm breaking the order. Did you know that this month, if you check your calendar, you will have 5 Fridays, 5 Saturdays, and 5 Sundays? Yes, the month of August has 5 Fridays, 5 Saturdays, and 5 Sundays. right? No, not true. You're not listening. You weren't paying attention. You will have 5 Saturdays, 5 Sundays, and 5 Mondays. I should have leave it and see if you're gonna call and tell me. 5 Saturdays, 5 Sundays, and 5 Mondays in this month. It doesn't happen often, right? They say the next time it will happen in 823 years. Where would you be in 823 years? Where would you be? You can't tell me you're going to be somewhere because you don't know, right? So you got 5 Saturdays, 5 Sundays, and 5 Mondays in this month. Okay? Take that for your fastness. Do something with it. Don't let it pass you and go without you doing something that will remind you of this August month, right? The next thing I want to talk with you about is some painkillers. Natural painkillers. We always want to know what to take for this or what to take for that, and y'all call me and bother the dickens out of me. Okay? Some people say, call a herbalist. Well, I never was a herbalist. I don't have a problem with a herbalist, but I never was a herbalist. I'm what you call a naturopath, right? For those of you who didn't know. Okay? Now, painkiller number one, if your ears are hurting you, don't ask me what to do with it, because we ain't got time to talk about it. Just write it down, and then you do your research, right? If your ears are hurting you, you want to use garlic. Garlic. Garlic is a natural antibiotic. I'll tell you that much. Okay? If your teeth hurts you, your tooth, if it hurts you, we know this is an old-fashioned one. Cloves. I remember my mother years ago when I had a toothache. She went into the cupboard, got a couple of cloves out, and said, bite these. And within minutes, I had no toothache. Cloves for your toothache. Apple cider vinegar. Apple cider vinegar. Real one, not artificial, not the ones that are Kanto. Apple cider vinegar. For your heartburn. Your heart burning you? Apple cider vinegar. Google it to see how you use it. Don't ask me. Right? If you have chronic pain or old pain in your system where it comes all the time and then it goes, it comes back. Turmeric. Turmeric. Very good for chronic pain. Turmeric. Fresh turmeric. Many of you have serious joint pains. Many of you have that. Serious joint pains. I can tell you whys and hows and all that, but I'll just tell you what's good for them. Okay? If you have joint pains, cherry is a very good one to help to remove the joint pains. Don't eat 2 and 5 cherry and come back and tell me it didn't work. And these things will work, some of them over time. Some are going to help you in a few minutes. Some will take a long time. For instance, the joint pain, using the cherry can take a long time. So don't come and eat 10 cherry and then come back and tell me, Doc, I eat the cherry and it didn't help me. Y'all do that too. Y'all is like take medicine one time and expect that they can create the miracle, and you come back and say, Doctor, medicine didn't help me. Take one tablet and expect it to create miracle. Someone do that, but not permanent. I used to love this fruit. I used to eat it with all kinds of things. Pepper, salt and pepper. I eat it with achar, all kind of things. I'm talking about a pineapple. If you have bloating in your abdomen, bloating where you swell up and you have a lot of gas, pineapple. Pineapple is very good for that. Also, cinnamon is good for that, right? Pineapple in the cold or cool, cinnamon in the warm, okay, or spice. If you have muscles that are sore muscles, where you feel achy and painy and so, you take some peppermint leaf and you put it there and you do some stuff with it, crush it and whatever. But peppermint leaves will help with your sore muscles, or the peppermint itself, the tincture of peppermint, you rub it in, just rub it in. Eventually it will help with the sore muscles, okay? Now this one is kind of strange because I don't know if you have it there, but you can get it now, I think, because it's imported. We don't grow it, I don't think, but maybe we do. Horseradish. Horseradish. Just remember the horse, like the one that gallop, and radish. Horseradish. This is very good for sinus pains and sinus problems, and I can understand why, because it has a pungent odor and taste, and if you use it, it goes up in your nostrils and everything starts to drain, right? So sinus pains, horseradish. Okay? If you have injury, if you have pain from an injury, for instance, if you had a situation where you hit yourself, right? I remember doing this when I was small. When you hurt yourself, your mother would make you some sugar water and bring it and give it to you to drink, and within a little minute or two you feel better, right? But water is very good for pain, injury pain. Water, no kidding, right? Plain water. Or even if you take the water and warm it and put a towel inside and take the towel and put it at the spot, warm towel, pain, okay? Urinary tract infections, blueberries. We should start seeing if we can grow some of these nice berries over there, right? Blueberries and also lemon, okay? Urinary tract infections, blueberries, right? So those are some of the natural painkillers and antibiotics that you can use to really overcome some situations, okay? I don't know what my operator have on the screen here now. She got, what she got? Sweet potato? She got a sweet potato, man. Sweet potato is linked to boosting pancreatic functions. Sweet potato. Yes, I've always told my patients who are diabetic, and even not diabetic, that if you have a situation where your diet is telling you not to use English potato, use sweet potato, right? Sweet potato has a very good effect on lowering the stress of the pancreas, and it also helps to reduce your exposure to pancreatic cancer, they say by 50%. 50%. Sweet potato, believe it or not, sweet potato, awesome. Ginger, next one is ginger. How much more time I have? I have some time. Ginger is very, very good for removing gas or acid from your intestine or stomach. Ginger. It is also very effective in removing pains from the inside. Ginger. Many of you, when you drink ginger, females, it triggers off your menstruation. Yes, ginger is very serious, and it's very good. Ginger is very good for your digestive system. It's really, really good. No kidding, right? So you want to keep ginger in the house. If you have a situation where you're having problems on the inside with indigestion and maybe pain in the stomach and so on, you make some ginger tea with fresh ginger, and you may add a little honey if you want, and you sip it warm, not hot. You sip it warm, and it's going to soothe the stomach and help to relieve the pain. Okay? Broccoli. I love my broccoli, but I don't like how my broccoli smells. When I cook it, I don't like how it smells. you know. But there's a saying that says, not everything that's good for you smells or tastes good. Ah, I love my broccoli, especially when you steam it and you put a little bit of, you know, spice or seasoning on it. Oh man. Broccoli helps with removing and fighting cancer cells. Yes, broccoli. Broccoli helps to flush out the chemicals. Once it is grown naturally without chemicals, of course, it helps to drive out those chemicals that induce cancer cells and make them become active. Yes, broccoli. Broccoli's a serious man. Don't play with it, right? I love it how it eats. I love it what it does, but I don't like how it smells. I tell you the truth, I don't like how it smells. Don't like it. Don't like it. Now, some of us like to eat certain things before we go to bed at night. And when you wake up with pain in your stomach and you have discomforts and you realize you're gaining weight and you're wondering why, it's because you eat the potato and went to bed too early. I'm guilty of that in the past, and I'm still guilty of it at times because sometimes you feel so hungry, you say, oh, I'll just take a baked potato. Potato takes between 90 to 120 minutes or 2 hours or an hour and a half to 2 hours to digest or come out of your stomach. And when you eat those things and go to bed with them in your stomach, you're gonna gain weight because they're not gonna digest and they're gonna become enemies to your body system, form fats, swell you up, bloat you up, and you gotta remove it. Easy to go down, but hard to come off. Right? So if you're gonna go to bed at 7 o'clock and you got a potato dinner, you better eat that potato at least by 5:30. If not, you're going to bed with potato in your stomach. And I know many of us, many of you are guilty of that. You eat the potato if it's French fries or scallop potatoes or baked potatoes or whatever it is. You go to bed before the potato come out of your stomach. I know that. And then you have problems. And then you gotta find me or find somebody like me or somebody who know, how to do what they do to get rid of the potato out of you. Okay? So stop using the potato and going to bed before it's ready to come out of your stomach. Now, this one is going to surprise many of you because it is said that if you're having a problem, for instance, like the one with the potato that ain't going to digest quickly, then you want to use some milk products to help to remove it out of your system, right? Wrong. Wrong. You don't want to use the milk product, like cheese particularly. Cheese. I love to eat a piece of cheese now and again. I ain't eating none this week. I ain't eating no food neither. Right? I'm practicing something. But the cheese that we like to eat sometimes before we go to bed takes at least 2 hours to come out of your stomach. Cheese. There's a place that's called More Cheese Please. And I see people line up to get the cheese and they go home and they eat, they go home and they go to bed. Problems. You're going to have fats like crazy. You're going to have indigestion afterward. You're going to have uric acid, all kind of things. Why? Because the food, the cheese, never came out of your stomach before you went to bed. Some of you wake up with pain or indigestion. Cheese. If you're going to eat the cheese, allow at least 2 hours before you lay down. Okay? Now, the fastest component that beats all records to come out of your stomach The fastest one is water. Water. That's why water goes right through your body, and then you drink a whole lot of water, you gotta go and pee pee. You know, water. And I want to make this clear. Juice is not juice is not water. Juice is not water. Many of you confuse yourselves by thinking that you're drinking juice and it's water. No. Water is water. Juice is juice. Not everything that says juice is juice either. Read the labels better. It contains some juice. Right? Like my grape that I'm drinking is no water but grape. I add the water because it's too sweet for me. Right? But it's natural sweet from the grape. No sugar added. Pure grapes. Many times I would juice pineapple, I would juice grapes, I would juice, fruits like that. And I would just drink them. And let me tell you, you buying pineapple juice in a bottle, in a bottle, and you think it's pineapple juice, you're buying pineapple juice from places that sell juices, you think it's pineapple juice. Pineapple juice, water, and sugar, and other things. When you juice your pineapple, my friends, it is so sweet. Even a sour pineapple tastes sweet when you juice it. I've proven that over and over, right? Water is not juice and juice is not water. Water is water. You want a sweet apple juice? Juice the apple. You will see. Sweet as ever. Pineapple, same thing. Water takes how many minutes to go through your system, out of your stomach? I bet none of you can guess, but you will know because you're seeing it on the screen. Water will go through your stomach. Oh, my operator, she's so smart. She's very smart. She already answered the question. Water takes 0 time to come out of your stomach. The moment it goes in, it starts to go out. Water. So sometimes when you think you're hungry, you're thirsty, right? Drink water. Water, in its true sense, that is good water, that's purified water, will go through your system in no time, will purge you. That's why we say when you want to purge, drink some water. Okay? Water will remove a lot of matter out of your system. You don't believe me? Check the streams. Check the rivers, check the drains, the ones that are working. You put something in there and the water is running, it's gone. The moment it lands, it's gone. Water, 0. In your stomach, out of your stomach. Water. Now this one here is a big one. This one here is one that many persons love to eat before they go to bed. Many persons would buy it and they would go to the seawall and they sit down and they have a little talk, or they sit in their cars, or they go home and sit in their chairs and their dining room tables and they eat. And here's what happens. This is where the problem comes. They're eating the chicken and they're eating the French fries. Yes, they're eating the chicken and they're eating the French fries. And the French fries takes at least an hour and a half to come out of your stomach, and so is the chicken. Yes. So when you eat the chicken and the fries, my friend, and you lay down half an hour after, 1 hour after, it's in the stomach. It's going to give you troubles after a while. Don't eat these things and go to bed early. That is the reason why I say to you most times, when you eat your dinner, allow 2 hours before you lay down. 2 hours. I do that because I want the food to come out of your stomach so you can lay down and not have a problem. I really love to see people well. That is my passion. I don't like to see people sick. Don't like it. I despise it. I hate to see somebody in a wheelchair. I want to grab them on that wheelchair and fix them. That's what's in me. That's when I look at people and they're sick, it makes me angry. And I ask myself, why did God make this thing called sickness? Why did he cause this disease to come upon us? This ease. I don't like you sick. So please listen and follow the rules. Seriously, right? Don't eat the potato and the chicken and go to bed. Don't do it. Okay? You're going to have problems. You're going to have problems. The last one I'm going to share with you tonight is one that I like to eat. And I don't know about you. I like to crack them and grind them with my teeth, especially when they're roasted. I'm talking about nuts. And not just peanuts. I'm talking about all nuts, even the walnut. Okay? All the nuts. They take at least 3 hours to come out of your stomach when you eat them. Yes, that's crazy. Why? Why the nut gotta take so long? It's so nice and crunchy, and you sit there in the evening and you crunch and you eat and you gaff, and then within an hour you gone to bed. That's the reason why we have problems. I remember the incident one time with someone that I was treating, and I gave this person everything I could, and I would sit them back, and they'd have the same problem. And I'm saying, come on, man, it's got to be something. You just can't be sick, and I'm doing everything I can, and you ain't getting better. Let's have a colonic done. Let's do some colon therapy. You know? Yeah, we do the colonics there. I don't have me doing them. We may not even do them again. But we do colonic. We both be qualified. We trained and everything.